Highs in the 90s, overnight lows in the mid-60s. Don't miss out. Get your tickets to Diamond Rio at the Santa Clarita Performing Arts Center, College of the Canyons, Saturday, June 30th at 7 p.m. with special guest Savannah Burrows. Tickets are on sale now. Visit canyonspac.com. That's canyonspac.com.
KHTS. Now FM 98.1 FM and AM 1220. Your hometown station.
Doctor, give me the news. I've got a bad case of loving you.
Good afternoon, Santa Clarita. Welcome to the Providence Holy Cross Health Hour. I'm Tom Burnaby, your host today, the orthopedic manager at Providence Holy Cross Medical Center. Joining us here today, third Wednesday of the month. I want to welcome everyone back. We've enjoyed another great month with Providence Holy Cross, and I usually like to kind of start it off and just making sure that you guys know, why is Holy Cross out here? 30% of all of our patients are coming from Santa Clarita. 30% of our employees are living out in Santa Clarita. If you blink, you're going to find another Providence billboard going up or a Providence signage going up as our specialists are slowly coming out to try to assist Santa Clarita in becoming a healthier community, which is our goal, especially as I am a person who lives out here as well. And Holy Cross itself has been around since the early 60s. We've been able to grow with Santa Clarita, and we're so glad to be able to be a small part of everybody's health. If you are a FACE member, then you are a Providence family member. And, it makes it very nice for me to be able to come out, to be able to come where I live and introduce Holy Cross, who I'm very passionate about, having been born at Holy Cross years and years ago. Now, I always throw in some stats, always kind of nice. I think I'd mentioned before, now that we have World Cup going on, the Olympics going to be in Japan coming up relatively soon. We had the Chukyo University, which is the premier sports medicine institute for Japan, out joining us for sports medicine talk a few months ago, and they're going to be one of the primary health providers at the Olympics when they're hosting coming up in the next bunch of years. Holy Cross itself, we're very honored to know that we were among the 100 best hospitals by health grades. Very honored to find that U.S. News and World Report has us considered as a high-performing hospital in a variety of surgical as well as normal health-related care. In California itself, Holy Cross is listed as far as a honoree as a top nurse employer. So much. Recently, we had to go off to a meeting as Providence joined with St. Joseph's Health System down in Orange County, as well as in a few other states. And, they kind of now mentioned what the breadth of what Providence Health System is, which Holy Cross is a proud member of. 51 hospitals, 114,000 caregivers, 24,000 physicians, 38,000 nurses. It is astronomical, the size. And because of that size, it gives us the opportunity to be able to utilize everybody's knowledge. 51 hospitals worth of patients that we can continue to learn from. We can derive data. We can see trends because of the breadth of the patients that we're actually getting a chance to care for. Now, Holy Cross specifically, we just ran some stats. 2017, we saw over 700 total joint replacements. That's just knees and hips, not including shoulders. So a lot of people are now walking better, easier, with less pain due to the efforts of our orthopedic surgeons, who we're going to be introducing one specifically coming up the next few minutes. And then one of the other pieces, too, we had Exer in a bunch of months ago, one of our new premier urgent cares that we have a partnership with, which is a great urgent care system. And the nice part of it is it's got only staffed by board-certified ER physicians. And so the acuity of care and the acuity of patients that they can care for very readily is very, very broad. And because of that, it allows us to be able to give urgent care to a number of patients here in Santa Clarita and then get them started in the right direction for a healthier self. That makes us very happy. But 110,000 ER visits in 2017 over Providence Holy Cross Medical Center. That is a little more than 300 ER visits per day, which is an astronomical number of patients coming through. And they do it with grace. And our patient surveys that come through that are being done by outside sources demonstrate that the satisfaction of those patients coming through the ER are fantastic. So it's nice to know that we have these great urgent cares that can take care of patients who normally would think they would have to go to the ER, which will allow us as a level 2 trauma center to be able to be more available to those really serious injuries. Okay, which it could include trauma and medical emergencies. And, we bring up trauma. It's a great time to go ahead and discuss it right now. We are in the midst of greatness, okay? I'd like to introduce Dr. Viswanath. He is one of our newest additions to Providence Holy Cross, however, has been caring for patients at Providence Tarzana.
That's correct.
And, he was able to, which we appreciate, one of our large HMOs recognize the talent of the orthopedists that were caring for their patients at Providence Tarzana, and they asked, would it be possible? And Dr. Viswanath is one of those. And Dr. Viswanath, welcome to KHTS.
Thanks for having me, Tom. Excited to be here.
Now, one of the biggest questions was, and Dr. Viswanath had this, was one, how do you know about KHTS? You can find us at 1220 a.m. You can find us at 98.1 FM. And if you are out and about and in LA or anywhere else in the nation, you can go to the KHTS, download the KHTS app. That way you can go ahead and listen to all of the shows and everything what's going on with KHTS and Santa Clarita at any time you want. Just go ahead and grab that app, which I know you mentioned that your wife was going to be doing to listen to the show today.
Yeah, she's hopefully listening in right now.
Perfect. And you're a new dad.
That's correct, yeah.
Well, you don't look tired.
I hide it pretty well. Pretty well.
He's got a voice for radio for certain. Just turn that bass up a little bit. So Dr. Viswanath, one of the biggest things that I have always been interested in to find out directionally how everyone made the decision to go the way that they did as far as their profession. Tell me, how did you decide on medicine, and then how did you decide to direct into orthopedics, and then more importantly, your specialty?
That's a really good question. I think the short answer is I played with a lot of Lincoln Logs and Legos as a little kid, but I think maybe the more in-depth answer is, I wanted to see kind of a tangible difference in the patient that I treated. Orthopedics specifically allows us to do that, and it's a great honor to be able to reconstruct someone's broken arm, for example, or torn rotator cuff, and allow them to function better. It's a very gratifying thing to see patients walk out of our office, after they've rehabbed from our treatment, and their quality of life improves. So that's kind of why I went into this, and
that's
very satisfying.
Now, Midwest born?
Yes, sir.
If I understand that right, you escaped Cleveland. My joke. But tell me about some of the training that you had.
Yeah, you're right. I did grow up in Cleveland. I stayed in Chicago for my undergraduate training at Northwestern. Went back to Ohio at Ohio State for medicine. Completed my orthopedic training under another hand surgeon, Dr. John Lubon at UPMC Hammett. And finally, I did some extensive fellowship training in upper extremity. That's shoulder, elbow, wrist, and hand under Dr. Alfred Hess. And that was down in Tampa, Florida at the Florida Orthopedic Institute.
Perfect. And then and it's interesting, too, because that fellowship allowed you to be possible to become board certified.
Correct.
Okay, now tell me about the board certification.
The board certification is a rigorous process. All orthopedic surgeons are required to take a 2-part test. Close to the end of our residency training, we take a written test, which essentially tests the orthopedic surgeon to be's knowledge about all different problems and pathologies, whether it be sports medicine, trauma, total joints, And that's the first part. The second part is more of a practical session when the surgeon is already in their training. It involves all of the orthopedic surgeons actually have to fly to Chicago to the Palmer House Hotel, and we gather in a room, and they are quizzed by experts in the field. It's a pretty intense sort of grill session, if you will. But it's a good system to ensure safety for patients, and it's a really great quality control check for orthopedic surgeons.
So, which it's very interesting, and I don't necessarily know. Most people understand how much you are watched over as far as your profession goes to assure that you're doing the best that you can. But then with your board certification for upper extremity and hand, was there more involved with that?
The specific process for me involved being tested by a panel that's expertly trained in hand and has been published in multiple national journals, specifically for the hand and upper extremity. So it's a focused group.
Right. And then how long was the fellowship?
1 year.
About a year.
Mm-hmm.
Yeah. It's extremely important to know, as a board certified specialist in upper extremity and hand, if you actually were to look around, whether it be in the Santa Clarita Valley or into the San Fernando Valley, there's not a lot of them around.
That's correct. There has been kind of a shortage in the valley areas. I've been kind of fortunate to be able to provide my services, both non-surgical and surgical, to a pretty large population, starting more in the West Valley area. It's an exciting time for the practice now to be moving also into the East Valley and then even serving this area as well, the Antelope Valley and Santa Clarita. Right now we're kind of in a growth phase and really excited to kind of extend our efforts and provide good service.
That's perfect. And then the actual group is?
Center for Orthopedic Specialists.
Perfect.
So we're a comprehensive group. We provide care, obviously for the hand, elbow, shoulder. That's me. But in addition, we have other fellowship-trained partners who are expertly trained in hip and knee, in spine, and soon to be foot and ankle.
Right. Oh, that's fantastic. It's the board certification piece, the specialty piece, really puts you as the foregone expert when it comes to the upper extremity. Fortunately, the upper extremity is mildly important from separating us from most of the other animals in the world, and so we want to be able to keep those as healthy as possible. And we are right in the middle of baseball. And we're coming up on the All-Star break, I think probably in the next couple of weeks would be my guess. And what we're finding is there's an awful lot of injuries now that are showing up. I know we lost our shortstop for the Dodgers to an elbow surgery. And, what I can say in my own practice as a physical therapist, where when I was treating more full-time, I might have seen one or two people who'd had Tommy John surgery in a 15-year piece, and I was treating primarily orthopedic and sports medicine. Within the last couple years of my practice, I would probably say I would have no less than 3 active patients at any time who had already had Tommy John, and the age group was getting younger and younger. What might you attribute that? These type of chronically related injuries on such a young, more active group?
That's a really good question. I think certainly there's a lot of increasing pressure in our society to become the next professional MLB pitcher and so forth. Unfortunately, these sports are kind of year-round sports. They're 12-month seasons. And so there's not a lot of break time, especially for our younger athletes. I think because of this, without that downtime, there's a lot higher of a propensity to get these chronic injuries, even in the younger folks. I think, from my end, patient education is very important. Obviously, surgical treatment is important too, but even short of that, I think what's a better goal is if we can educate our patients before they get to the point where they need surgery.
Right.
I think it's important for patients to have a decent amount of downtime and recognize, their long-term goals, which maybe if it is to play for the rest of their life, that you do need an off season to some degree.
Right. And the what we're also finding too, and maybe you want to comment on this, is that I think that the talent, and Santa Clarita, and the guys in the room will probably agree that the talent of baseball players, we'll use that as an example, coming from Santa Clarita, I think we have, six? I think we have 6 people playing in the pros right now, and a lot of them are pitchers. And so now we've got a tremendous talent pool where kids are at a younger age able to accomplish more within the sport, throwing harder, throwing different pitches at a much younger age. Is there anything to skeletal maturity that might have a contributing factor to being able to overcome the stresses that are being placed on our athletes?
I think there's an old sageism that says that if you're young, you're going to heal faster, and to some degree that is true. But the issue with those athletes and those weekend warriors, if you will, that are skeletally immature, the issue is that they do have something called growth plates that are still active. Now, in adults, typically the weakest point in our joints is where the ligament meets the bone, and that ends up usually in a sprain or even a ligament tear. Now, with the skeletally immature, or people that are still growing, their growth plates, they're a very soft part of the bone, and they're still active and still delicate. Now, because of this, we find that the failure points are at those growth plates. And so it's something we certainly worry about and try to educate our patients about. But again, it kind of underscores the fact that, even though, your athlete may be young and durable, they still need to be protected.
Correct. And then growth plate injuries by themselves, unless there's a very large separation, it's going to be very difficult for a generalist, maybe just primary care or an urgent care, to be able to recognize when there's a growth plate injury versus maybe some generalized tendonitis. That bringing that specialist in to actually get a good look at that, because a growth plate injury, if not rested and allowed to heal, that can have a more chronic effect later on.
That's a very good point. I think, if, my goal is to tell people that if there's a concern, have it looked at. Right. It makes good sense to, if your pitcher or, a junior athlete is having a problem during sports, it makes good sense to bring them in. Again, it's good if someone has a good outcome after surgery. It's better if someone doesn't have to have surgery and ultimately takes a little bit of a break and then can resume their activities at full speed.
Right. Perfect. And I know now, in going through your bio, searching you online, you actually have an online presence. Though you would never think about winter months on a day where we're supposed to be almost touching, flirting with the 100 mark, but snowboarding. All right, so you enjoy snowboarding.
I do.
And yet snowboarding can contribute a wonderful patient load to you. Is that right?
That unfortunately is true. Yeah, I do get quite a bit of snowboarding injuries and skiing injuries during the winter months. One thing I always tell people, if you want to avoid a wrist injury and you're out on the slopes, wear wrist braces.
Right.
It's a good solution. Personally, when I go out, needless to say, I'm not doing 1080s in the skate park, but in any case, I'm wearing wrist guards, and I found them pretty helpful.
Right. So prevention actually is probably the first defense to any injury.
100%.
100%. We're going to talk about that a little bit more, kind of leading into that. But I'm thinking in the next, because we're going to get ready to go off to commercial break, but would love to be able to get into a little bit more for prevention. I know that you're a musician as well, and it's an interesting group for the instrument that you play, because there are a lot of upper extremity injuries that go with that that I've had the pleasure to work with, and but also want to be able to go over some of the trending type of things as far as what are we seeing more of? How can we better avoid those types of injuries going forward. So I think we're ready to go ahead and take a break here with the Providence Holy Cross Health Hour on the KHTS, your hometown station. We'll see you back in a moment.
The best live theater can be found right here in the Santa Clarita Valley. The Canyon Theater Guild has been entertaining audiences for decades with top-quality musicals and plays. Located on Main Street in Old Town Newhall, CTG also offers workshops for the young actor in your family. For more information, call the box office at 799-2702 or go online to canyontheater.org.
Who says nothing good happens after midnight? Denny's is best known for their breakfast served round the clock, like the Grand Slam. But you can enjoy breakfast, lunch, or dinner in a casual atmosphere 24/7. At Denny's, the lunch and dinner menu has a variety of appetizers, craveable burgers, salads, and entrees, along with the best desserts in town. Wherever you live in Santa Clarita, there's a Denny's close by. If you're pulling an all-nighter or don't feel like cooking, get into Denny's today. Good stuff is happening at Denny's.
Woodward Kitchen and Bath started in 1988 with my husband and myself as a mom and pop shop.
Lisa Woodward.
We started off with my husband and myself. We've grown from being a cabinet shop to being a full one-stop shop, so we can do the whole turnkey project.
Let Woodward Kitchen and Bath transform your Santa Clarita home.
We do everything in-house, can supply everything, and it's the same person you'll be working with from the start of your project to the end. That's what makes us more special than somebody else down the street.
Woodward Kitchen and Bath, woodwardkb.com.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Hey there, I'm Tori with your hometown station weather. Sunny and hot today most of the week. Highs in the 90s. Overnight lows in the mid-60s. Don't miss out. Get your tickets to Diamond Rio at the Santa Clarita Performing Arts Center, College of the Canyons, Saturday, June 30th at 7 p.m. with special guest Savannah Burrows. Tickets are on sale now. Visit canyonspac.com. That's canyonspac.com.
Now FM, 98.1 FM and AM 1220, your hometown station.
Doctor, give me the news. I've got a bad case of loving you.
Welcome back, Santa Clarita. You're joining us here on the Providence Holy Cross Health Hour. I'm Tom Burton, your orthopedic program manager with Holy Cross. Coming to you from the Newhall Studios. To you on 1220 AM, 98.1 FM, as well as the KHTS app. And we are so pleased to be able to have Dr. Viswanath with us.
Thanks for having me.
Glad to have you. And he is an orthopedic surgeon, board certified upper extremity hand surgeon. And he is recently joining us with the Holy Cross family, though he's been a very active member of the Providence family over Providence Tarzana. And I think as we were finishing up with the last segment, there was a little bit of a discussion regarding wrist fractures and snowboarding, the idea of wearing the appropriate braces, the appropriate equipment. But, let's talk about fractures a little bit and possibly what we would see as far as who can be handled conservatively, who maybe with a wrist fracture or a forearm fracture, or who does need to go to surgery to have it fixated. So maybe you can give some helpful hints.
Thanks, Tom. In orthopedics, it's always difficult to guess the severity of your injury without an X-ray. My biggest suggestion is if you're having pain and you're having problems with the functionality of your wrist or elbow or shoulder or what have you, it's good to have it checked out. We treat injuries, whether they're high-energy injuries, whether that's from a motor vehicle accident or a motorcycle accident, even to the not-so-severe injuries, like a fall from standing height and things like that. Oftentimes, people may even be surprised at the severity of their injury. So it's a good idea to get these injuries checked out. As far as time span goes, the sooner the better. Unfortunately, as the bone heals, it may heal in the wrong direction, if you will. We call that a malunion, which is something that anybody would want to avoid. Right. The problems with the malunion might result in stiffness of a joint, lack of mobility, lack of function. Mm-hmm. But I think it's always helpful to get evaluated first.
Very good. And, I kind of bring this up, and we were talking about my man card during one of the breaks, and that while watching The Bachelorette, they have a professional athlete, football player who happens to be one of the bachelors on this show, and they were playing a form of football game, and he was running with the ball, and didn't look like he actually had a really high or intense contact type of an injury, but ended up with a wrist fracture. And, and this is his off season, and the physicians all agreed that let's get in on this early window because it's going to allow him the opportunity to be trained and ready to go when the season starts to start up. Tell me about the window. What are we looking at window-wise on an injury where, as an orthopedist, you would like to see that patient, within a certain amount of time, and that usually does assist an outcome. Is that right?
No, you're absolutely right. Within the first week is kind of our golden window where you want to have your initial evaluation. For wrist injuries specifically, this can result in a less invasive procedure if it does actually need a procedure. Mm-hmm. And you're right, this can help in better outcomes. By outcomes, we mean better flexibility, better strength in the long run. It's a more difficult problem when someone comes in after having neglected an injury, because that can sometimes result in the need for pretty extensive surgery. Right. Do these types of problems walk through my door on a daily basis? Yes, they do. Right. And we're happy to treat those. But ultimately, for the patient's benefit, I think it makes sense to get it checked out early to benefit their own outcome.
Correct. And then, so we see that with whether they get, we may just do a reduce that fracture and then cast versus going in for surgery. But normally after the fact, is there a form of rehab that's usually necessary? How do you gauge if the patient would need therapy versus not need therapy after whatever commensurate amount of time needs to go by?
Every patient is an individual. Some of these patients may require some extensive physical therapy to get back to their original functionality. Mm-hmm. Some patients might not. So it's hard to create a hard and fast rule. But, if my expectations for a patient are that they can't quite be able to attain those goals of, returning back to their running back status as a professional, or as far as, being able to just cook in the kitchen and mix a bowl of rice, for example. Right. If those post-injury outcomes are not going to match up, then, we definitely would recommend physical therapy.
Right. Now, we're lucky enough over at Providence Holy Cross in our outpatient rehab where we have a certified hand therapist. Do you have a preference normally that for your hand and elbow injuries that you'd actually like to see the certified hand therapist? They do carry a certain level of skill. And
I find that the hand therapists in our area do a great job. I think they're very well suited and understand some of the subtleties in the hand. The big problem that people with hand injuries face is something called adhesions. There are a lot of different moving parts in the organs in the hand, and they need to slide and glide freely. And they do that for the most part prior to an injury. But after a lot of inflammation caused by a broken bone or a severed tendon or a contusion, adhesions start to form, and as a result, you get less sliding and gliding of your tendons, and so as a result, therefore, you get stiffness. I think hand therapists are very well trained in handling these problems, but that's not to say that a good physical therapist, Tom, would do a great job in doing this as well,
right?
Helping with that.
And then one of the things too, do you utilize post-injury rehab protocols normally, or do you have a specific group of protocols that you like to work with?
I do.
Okay.
I do. There are several protocols out there. One good example is Brigham and Women's Hospital out of Boston puts out a very good rehab protocol for flexor tendons that I've been following. And I try to encourage my hand therapists to follow that because I think it works very well.
Right. And for those who aren't sure what a protocol is, it's not really a recipe per se. However, it does usually have nice time frames and specific landmarks where once you reach a certain spot, you can begin doing this, and once you've reached that goal, you can move on to that. Not allowing too quick of a progress because tissue still has to heal, and we definitely don't want to interrupt that process, but we want to be able to intervene reasonably soon enough to avoid such things like an adhesion.
Absolutely, yeah. Protocols, are not written in stone, but they are the recommended treatment plans that are prescribed over time. I think the unifying theme of most orthopedic injuries nowadays is early motion.
Right.
We're finding that now that we have better ways to allow your tissues to heal, we are less restricted in immobilizing patients and keeping them stuck in splints and casts for too long. And so that goes back to the previous point about coming in early. If something is bothering you, it makes sense to get it diagnosed, get it treated, and therefore we can get you on your rehab pathway sooner.
Right. And then now the kind of pulling away from fractures a little bit, even though as important as that is, there's an awful lot of just general strains and sprains that we come across. And one of the more common ones that we find, especially during this time of the year between people going out and being active with tennis, swimming, baseball, getting ready to get into contact for football, as everyone's going to be going into their high schools are going to be returning back to their practices and such coming up relatively soon. The rotator cuff injuries, kind of give an idea of how common of a problem this might be. How is it most easily diagnosed? If someone comes in with pain, what gives you the best air quote look as far as how this should be diagnosed and then how to care for it afterwards?
Sure, that's a really relevant topic. I think that is a problem that hits certainly all of our athletes, but you don't have to be a professional athlete or even a high-level athlete to have a rotator cuff problem. You may just be a weekend warrior, or you may just be someone who needs to reach in their upper cabinet to grab a pot or a pan. The biggest worrisome factor for me is when someone tells me that they have pain with overhead motion. Mm-hmm. And again, that can be with your serve in tennis or your pitch, or it can be from, again, reaching and grasping things that you need for your standard activities of daily living. One common quote that I'll hear is that, "Doctor, I've had pain in my shoulder for quite a while, and this has been nagging me, but I was able to work through it. But now, finally, I feel like I just can't, and I can't even lift my arm." Unfortunately, this is a common sort of, air quote that I hear that probably maybe could have been avoided if it was looked at sooner. But again, pain with overhead activity is really the biggest worrisome factor.
Right, and then the difficulty lifting afterwards, that always raises that ire of suspicion that there quite possibly could be a tear of some sort. And you're going to be able to see that with diagnostic imaging, special testing, things like that?
Correct. After a careful physical exam, I often will order an MRI to get a good idea of what the muscles and tendons look like. That is kind of our standard in diagnosis, short of surgery.
And now, one of the things that I'm noticing, too, is starting to show up clinically is a lot of MSK ultrasound. Now, is that something that could be utilized in order to actually take a quick look and see what the integrity of the structures would be?
It can be. There is literature that shows that it does have its benefits. Oftentimes, we will use ultrasound to aid with our injections to make sure that they're in the proper location. And I think ensuring this will give you a better result with your injections. These are optional. but they are certainly available and helpful.
Right. And then the MRI itself, usually it's a standard procedure. No, not usually. You don't have to use dyes with that unless maybe they had previous surgeries.
Typically.
And so for those of you, if you've never had an MRI, it's usually going to be about a 20 to 30-minute procedure to be able to take a look at a specific area. And that really does give you a really nice look inside.
Yes, that's correct.
Right.
One of the drawbacks of a standard X-ray taken in the office is that we can only see the bones. An MRI provides kind of the remainder of your organs, if you will. That's the soft tissues, including the muscles and the tendons.
Right. And then in the case that you do have someone who has maybe a partial tear of a rotator cuff tendon, it's not always a requirement to go through surgery. Is that right?
That's correct. It's my belief, and this has been borne out through the literature, that patients with partial tears often can do quite well just with physical therapy.
Okay.
And that's where you guys come in. The vast majority of my patients who have these partial tears, I send them for a fairly extensive trial of physical therapy to see if they get better. Obviously, we have the option of going to surgery if need be, but I think it makes good sense to try conservative means first. Typically, with partial tears, they're more associated with pain, but not necessarily weakness.
Right. And then, just from the physical therapy standpoint, our goal is always to try to improve mechanics, to try to allow somebody to have a more balanced scapula, to make sure that that's sitting in the right position, because anatomy has a tendency to bump into anatomy, and always kind of use the idea of the Chuck Taylors, the shoelace rubbing through the eyelid. Eventually, when you cause friction or compression over a tissue like that, it's going to eventually give. And so the actual mechanical portion on how a person moves is going to be hugely important, not only just to being able to maybe get past this shoulder pain, but in the case they actually have to go through surgery, it's a wonderful springboard, because when they actually get started after surgery, they're going to be ahead of the game. And then normally with surgery, let's just say you have maybe a medium-sized tear, how quickly is someone able to start thinking about returning to activity? Whether it be through no lifting, but actually moving without a sling on, to being able to get back into just general everyday activities.
Again, it's a little bit of individual differences between patients, but also sticking with some kind of protocol. My patients who undergo rotator cuff repair will have 6 weeks of immobilization with a sling. After this, we begin motion to avoid excessive stiffness in the shoulder. I counsel my patients and tell them that it's going to be a good 6 months, 8 months before you're feeling like you can get back on the court. It is a little bit of a extended duration, but I think the thing to remember is that we need to maybe forego this year's season and keep in mind next year and the subsequent year's seasons.
Right. So in essence, if you allow that injury to properly heal and to get that individual back into game shape, if you will, that's going to decrease the risk of re-injury going forward, and maybe requiring less time, being able to avoid more time away from their sport or from their activity, depending on what they're doing going forward.
Correct.
Okay. So I did dig in a little deeper on your bio, if you will, and interestingly enough, I've enjoyed this population of patients. But you drum.
I do.
What type of music do you like?
I guess you could say I used to drum in another lifetime, but. When I do get the chance to play, I play a lot of fusion and funk.
Okay.
Yeah, in the style of David Garibaldi.
Okay, yeah. Sure. Now, as a drummer, especially if we were to pick the sticks back up and try to actually play a set, what type of injuries? It's interesting because we have Cal Arts is out here, and a very, very prominent schooling specifically for musicians as well as performers. And what type of injuries as a drummer do you find or have you seen?
Absolutely. That's a good question. I've had, ironically, several patients come in who are drummers and note that they have these wrist pains and finger pains and so forth. There are a lot of repetitive overuse injuries that come in through our doors. These include problems like carpal tunnel syndrome, trigger finger, tenosynovitis, and luckily, the treatment for these oftentimes may be simpler than things like a rotator cuff or a fracture, which is nice. For the most part, these types of repetitive injuries can be improved with certain types of bracing exercises and taking a break between your drumming sessions or whatever activities that you're doing. Ultimately, if all of these conservative methods don't work, there are surgical treatments for these that work very well.
Okay. And I know we're coming up on another commercial break and within the next minute or so. And I know it's going to be of extreme interest when we come back from the break. We're going to try to tie up any loose ends. And then we want to make sure that patients know how to find you, which is going to be a big deal as well. It's not often that we have the opportunity to, one, have a board-certified specialist specifically to upper extremity and hand within the San Fernando and Santa Clarita Valley, and we want to be able to take advantage of that, and we want our listeners to be able to take advantage as well. So when we come back, we'll get an opportunity to find out how we can find you. You're joining us here on the Providence Holy Cross Health Hour and KHTS, your hometown station. We'll be right back.
I've been into cars ever since I was 6 years old. I helped my dad build race cars in our driveway.
Dave Reeves, owner of Reeves Complete Auto Center.
I love cars. I've been in automotive service my whole life. I ran my dad's wrecking yard and rear-end shop, managed several auto repairs until I opened my own auto repair facility.
Reeves, on Ruther in Canyon Country.
I learned customer service and honest communication make the difference.
Reeves, your complete auto service center.
Call Reeves at 252-1400.
Healthcare can be difficult if you're underinsured or have Medi-Cal. Samuel Dixon Family Health Center can help. Services are available on a sliding fee schedule. The mission of the Samuel Dixon Family Health Center is to give the Santa Clarita Valley access to affordable, quality primary care. There are 3 locations to serve you: Canyon Country, Newhall, and Valverde. Go to sdfhc.org for more information and to find the location most convenient for you.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Now FM, 98.1 FM and AM 1220, your hometown station.
Doctor, give me the news. I've got a bad case of loving you.
And welcome back, Santa Clarita, joining us in the Providence Holy Cross Health Hour, KHTS. And because we always seem to be rushing at the end because there's always a lot of information to be able to go over. But Dr. Viswanath, Dr. Viswanath is in with us as our in-studio guest today, orthopedic surgeon, board-certified hand and upper extremity specialist. How do our listeners find you?
Well, Tom, it's easy. Let me give you the information there. It's you can reach us at phone number 818-403-6337. My office address is 11550 Indian Hills Road, Suite 300 in Mission Hills. That's right across the street from Holy Cross Hospital. And then you can visit our website at COS-orthopedics. That's ORTHOPAEDICS.com.
Perfect, and we'll repeat that again. However, we talked about it before, how important prevention is, and I know we have a few minutes, and you have a top 5 that you want to go over.
Sure. I prepared a list. I guess we could call it Dr. V's high five of prevention of injury, just to go through. The first one is being careful about your risks, of course. We talked a little bit about this during snowboarding, but any sort of high-speed activity, whether it's riding a horse or inline skating, for example, we have a lot of those in Los Angeles area. It's important to protect those wrists. There's a lot of injuries that come in through our doors that could have been prevented with simple wrist guards. Moreover, on that note, it's also very important to be a good roller, if you will. So what that means is being able to fall correctly and being able to dampen the impact. It's important to talk to your coaches or your riding instructors about how to take to the ground more effectively so you don't bring all of the impact on one joint. The third thing I wanted to mention is more for the repetitive stress injuries. So for our office-based athletes, if you will.
Yep.
We're talking about things like carpal tunnel, tendinitis. It's very important to stretch out. Maybe once every hour, maybe spend 5 minutes if you're allowed to, and stretch out those wrists, elbow, and shoulders so you don't get stuck having tendinitis at the end of the day. And moreover, number 4 is warming up. And that's whether you're playing sports, doing work, or any kind of repetitive or high-stress activity. You want to be able to gradually increase your intensity until you get to a point that's required by your sport or by your job. There have been studies that have shown that both stretching out and warming up have lowered the risk of muscle tears. But probably the number 5 and most important thing, in my mind, is to be honest with yourself and to be honest with your symptoms. If it's hurting you when you're doing whatever it is that you do, whether it's your work or your sport or activity, it's important to be mindful of this and not let it get worse, have it get checked out.
Pain's a protective mechanism.
That's correct.
Yeah, it's a nice little hint. You want to listen to the hints. Don't wait for the brick wall. That's one of the things to try to tell our patients as well. And I do appreciate the fact that you did bring up the idea of warm-up and the necessity to avoid the static positions for a prolonged period of time, actually getting up and actually moving yourself, moving your body, moving your hands, moving your fingers to try to decrease the amount of stress that we're placing on our joints, whether it be on the field or if it's in the office. So hugely important. And then, we don't talk about it enough, but I know we have a few minutes. Tell me about, now nutritionally, we have to be able to feed the machine correctly as well. I mean, we try to put the best gas we can into our cars. We should be putting the best fuel into ourselves as well, and that could include...
It's important to maintain a healthy diet. You're absolutely right. I think building your foundation is important, whether you're a professional athlete or a weekend warrior or even non-athletic. A high-protein diet can be helpful. This includes things like milk, poultry, even meats, if you're allowed to eat meat, that is. For our vegetarians, eggs are very important, and even for our vegan friends, things like legumes and soy and almond-based proteins are very important. These come into play from a biochemistry standpoint when healing a fractured bone. You'd be surprised at how much longer it can take someone who is malnourished to heal a fractured bone than someone who has proper nourishment. As far as supplements, I counsel my patients that vitamin D and calcium supplements are going to be very important, and you actually need to bump up that supply if you're taking it anyway, if you're healing a fractured bone, for example. Lastly, vitamin C has also been shown to be helpful in preventing certain types of stiffnesses after an injury, and so I counsel many of my patients on that as well.
We learned that with scurvy years ago, and the variety of issues that can occur if we actually take vitamin C away from the diets. And it's so important. We talk to our patients, especially the ones who are going to have surgery, that we want to make sure that they are giving their bodies the appropriate building blocks necessary to heal injuries, which is going to be extremely important, as you were saying, with the higher protein within our diet. But more so is that we need to supplement our diets based on the healing that's actually occurring. So we may have a fairly healthy diet as it is, but we may need to complement that further in order to be able to address our injuries. And so even our post-surgical patients, you would actually give information as far as you need to fuel yourself in order to be able to heal yourself.
Absolutely. I think simple things like vitamin C and other supplements, they're easy to take. Yeah. And they're obviously less burdensome than having to travel out and seek other medications and go to a pharmacy specifically for. And so simple solutions like these I found have improved my patients' results over time.
Absolutely. And with the vitamin D, which we're finding is important not only just for bone healing, but for our general health, just spend a little time outside. They anticipate about, I think, 20 to 25 minutes of exposure to the sun will allow you to actually develop your own vitamin D that you can actually make internally. And it burns just a skosh of cholesterol, too, which isn't a half bad idea either. So being able to get in and do that. Now, because we seem to be pacing ourselves beautifully, can you go over your address, phone number, and website again so that way we can make sure everyone gets to you?
Absolutely. Our phone number is 818-403-6337. My office address, again, is 11550 Indian Hills Road, Suite 300, again, across the street from Holy Cross Hospital. And you can find us online at COS-orthopedics. Again, that's ORTHOPAEDICS.com.
I appreciate the old school spelling on it, too. So, Dr. Viswana, thank you so much for joining us today, taking time out of your schedule to actually join us here in studio. And want to thank KHTS for giving us this opportunity as well. You've been joining us here on the Providence Holy Cross Health Hour on KHTS, your hometown station. We'll see you next month.
Are you gonna stop?